Hello, I'm Dr. Michael Morris, and I'm a health services researcher here at the Health Science Center at the University of Texas at Tyler. And I'm here with my colleague and friend, Dr. Paul McGaha. Paul?
Dr. Morris, good to see you today, and thank you for that introduction. Yeah, I'm Paul McGaha. I'm a physician. My specialty is in preventive medicine. I'm also the Smith County Local Health Authority here, and I've lived here for 30 plus years, worked in the public health domain and community health, have a passion for improving the health of citizens all throughout East Texas, and we are very excited to be talking about the All of Us Research Program today. The All of Us Research Program is funded by the National Institutes of Health, and we're a partner in that project here in Tyler, Texas. We're very happy to be doing that. The goal of this massive undertaking is to recruit 1 million people into this long-term study called a longitudinal study for years, maybe decades, recruit them into this study from the East Texas area so we have a representation of our rural residents and other people that we have here, which they deserve. It's not a disease-specific study. They'll be gathering all sorts of clinical information. I've signed up for the program. It's a simple thing to do. You complete a survey about your health. You can volunteer to give information about your genetic material and things like that. Dr. Morris will mention a lot more of those details later. But the goal is to speed up discoveries related to health. If 1 million people enroll in this project, you can see how they would have different samples, different data, put those together and make discoveries moving into the future about what's causing certain illnesses, what genetic composition people have that make them susceptible to certain diseases, and just a lot of very exciting discoveries that can be made by this study. So we're happy to be participating in it here. Let me let Dr. Morris give you more details on the specifics of the All of Us study.
Well, are you eligible? So anyone here in the United States over the age of 18 is eligible to participate. Children are not included at this time. They may be in future iterations, but right now it's for anyone that's over 18 living here in the United States, and particularly those of us in East Texas. Now, why would you consider taking part in this national database of research? From the personal perspective, you're going to get access to data about yourself and your health that you might not have otherwise. One of the opportunities within this program is access to genetic testing, which you would be available to you at no charge. In the bigger picture, though, why would you want to take part in this? And that's to make a difference in the community. Our knowledge of science and our background of what we know about our health has really been developed through the growth in knowledge from long-term panel studies of patients, people like you and me that contributed our data. The Framingham Heart Study that was started in the 1940s, it really revolutionized our understanding of hypertension, cardiac disease, and strokes. This was the 1940s. Today, the All of Us Research Program is that Framingham Heart Study. It's our opportunity to learn more about medicine and to make a difference in our communities going forward. But I know everybody's going to be having some concerns, particularly adding their personal data into something this large. Paul, as a physician, I know that you're having more experience dealing with patients and their experiences with these type things.
Yeah.
Could you talk to us a little bit about the concerns over privacy?
Yes, we're always asked in any forum, how safe will my information be if I sign up and I donate this information? And I can tell you, as one who has enrolled in the project, I'm comfortable with the security settings at NIH. I mean, people can go in, they take a survey, and then they can volunteer to participate in many components, the genetic testing, there's some blood sampling that some people go through, and then they can volunteer to submit their electronic health records in the process. But you can do any or none of those, basically. You're able to select whatever you want to. And that, in my opinion, they've set the bar high as far as security settings go.
And how would we go about registering? I know that there are access through the NIH portal. Are there other ways that we might be able to do that based here in Tyler?
Sure. We have our own unique website, Dr. Morris, and a portal of entry people can access here. We want you, frankly, to sign up through our website because it is reflective of what we're trying to do here in the community. And that is directly linked to our partners in Houston and at the National Institutes of Health. So we're hoping people will go in. You'll have information on your screen that you can go in and sign up. It's, again, an easy process. I've been through it. And we're hoping to capture people in East Texas through that portal to be more reflective of what we're trying to do here and show that our efforts are working.
Well, thanks, Paul. And thank you all for joining us for this brief talk about the All of Us research program. And you'll be able to find more information attached to this video. And let's go take that walk.
There you go. We're there. Thank you.